I want to welcome everyone who's here today for this hearing on our Veterans Administration facilities in Atlanta and really the Veterans Administration services for health care all over the United States of America. I want to first of all welcome our veterans who are here. None of us would be in this position today if it weren't for those who fought and risked their lives on behalf of the American people. And I wouldn't be here today as a member of the Veterans Committee if I weren't committed to seeing to it the promises that you were made when you enlisted and when you served or kept by your country. And that includes the health care of your life for the rest of your life and the services that you and your family need. I want to thank Dr. Mark Becker, the president of Georgia State University, for his outstanding service to our state and facilitating this meeting today, and my longtime friend and his right arm, Tom Lewis, who's here today, who made a lot of this happen. We're very grateful to Georgia State University for all their hospitality. I want to welcome General Butterworth, the Adjutant General of the Georgia National Guard, who will testify in our second panel. But most importantly, with deference to every other important person that's here, I want to introduce Pete Wheeler. Pete, wave. Pete Wheeler. I've been in elected office in Georgia since 1936. Pete Wheeler has been the Commissioner of Veterans Affairs since the 1940s. 65 years in the state of Georgia serving our veterans. Pete, you're wonderful, and we love you very much for what you do. To all our VSOs that are here today, thank you for the service you give to the veterans, and as I said before, to all our veterans, thank you for what you do. We are here today to talk because we had a problem in Atlanta at the Atlanta VA. And it's been in the news, and it's been in the newspapers, and it's been on TV. We have the adjutant, the IG today, the Inspector General, and his deputy. We have Dr. Petzel, who I want to thank for coming today, who's the head of Veterans Health Care for the United States of America. Mr. Sepich, who's the VISN Director for VISN 7. And I want to tell you all up front, we have a lot of acronyms in government. We have far too many acronyms. If we say too many that you don't understand, just stop us. VISN is the Veterans Integrated Service Network. Did I get it right? Yes, sir. Yep. That serves our veterans, and he serves the state of Alabama, the state of Georgia, and the state of South Carolina. I want to welcome Ms. Wiggins, who's the new director of the Atlanta VA and came on board about 2 months ago, I think, and has done an excellent job trying to deal with some of the problems that we had. We had a tragedy at the Atlanta VA. Through unfortunate circumstances and unfortunately mismanagement, we had some totally unacceptable and inappropriate occurrences take place, which contributed to the loss of 3 American veterans. We've had an IG's report to outline recommendations to the Atlanta VA and to the VA in its totality as to what it needs to do to improve that situation so that it never, ever happens again. Those circumstances were difficult and they were troubling, and the failure of the VA system in those 3 cases was to me deplorable. From that, we must learn and make sure it doesn't happen again, and we deal with the needs of our veterans in the future. Although he hasn't testified yet, I want to steal a sentence from Dr. Petzel's testimony, this first sentence of the next to the last paragraph, where Dr. Petzel says, VA has the opportunity and the responsibility to anticipate the health care needs of returning veterans in America. The opportunity and the responsibility. The serious problems we have had with mental health in our military are the future challenge of the VA administration and VA hospitals and VA health services in America. And there are lots of contributing factors. In Operation Iraqi Freedom and Enduring Freedom and Operation New Dawn, which is the Libyan operation, we lost a total of 6,729 American servicemen in uniform in 12 years. In 1 year, this year, we'll lose 8,000 veterans to suicide. It is a rampant problem that's getting bigger and bigger and bigger. 22 per day, 8,000 per year. And not just combat related. In fact, combat is not necessarily the principal cause. PTSD and TBI can. Drug abuse can be. Family situations can be. Lots of different things. But nonetheless, it is a rampant problem. In a survey of our soldiers by the Iraq and Afghan Organization of America, those veterans, they found 30% of the respondents to their survey say they considered suicide, and 37% said they knew someone who had attempted suicide. That's in our military. The United States Senate in the month of September will begin hearings on a DOD authorization, but the principal focus of that authorization is going to be looking at how sexual abuse is reported in the military. Because sexual abuse and military sexual trauma is one of the contributing factors to suicide in Americans' veterans today. We've got to do a better job We've got to improve the culture within our system to see to it we eradicate to the maximum extent possible these problems. You're never going to get rid of all of them. That's probably not possible, but your dreams ought to be to get rid of all of them. And when you have a failure and a breakdown in the system that contributes to the loss of life of an American veteran, an American citizen, then it's time to have a call to action. And that's what this is today. My goals are to accomplish two things. First, to go over what's been done at the Atlanta VA to address the IG's findings and see to it what happened at the Atlanta VA never happens again. Secondly, to be ensured that the VA nationwide is learning from our experiences. And I know there have been other problems in other VAs, in Pittsburgh and other facilities. We need to learn from these experiences of what we owe our veterans and how we can better serve them in terms of mental health. But we have a second panel as well. The second panel is going to have the Adjutant General from the Georgia Guard to testify. The Guard is an equal partner in the defense of the United States of America. Every Guardsman, and correct me if I'm wrong, General, every Guardsman in the Georgia Army Guard has been deployed in Iraqi freedom or enduring freedom except for the band. Is that correct?
Some of the band too, sir.
Some of the band's been there too. The Georgia National Guard is an integral part, as is the National Guard nationwide, of our freedom in this country and the defense of our country. And General Butterworth will testify. We'll also have outstanding providers from mental health facilities in the city of Atlanta, Peachford Hospital, Wellstar Health Systems, and my dear friend James Shepard and the Shepard Spinal Center, which does so much great work for wounded warriors, for veterans, and people with spinal injuries. We'll also have the Wounded Warrior group testify. Vondell Brown, who's the head of their alumni group, will testify, and he served the United States of America as well. And the reason they're here is this. This is not just a VA problem. This is an American problem. And the VA has got to be open to the solutions of those in the private sector who deal with these problems. We need a solicitous VA that welcomes the support and the solutions and the recommendations of the private sector that works day by day in the same community, dealing with the same types of problems. Suicide has a terrible stigma to it, and people do not like to talk about it. Drug abuse is a horrible thing, and people don't like to talk about it. Sexual harassment and sexual abuse is a horrible thing, and people don't want to talk about it. But 8,000 American veterans will die this year of suicide, and contributing factors and comorbidities will be sexual abuse, drug abuse, or problems of that nature that all go back to mental health. This is an important hearing, not for me as a United States Senator, and quite frankly, not for Dr. Petzl as the head of the Health Department. It's important for the veterans of the United States of America, their survivors, their children, and their future and the future of our country. Dr. Petzl and I are merely tools of the American government to deliver on the promises the American government has made to the veterans of the United States of America. And I, for one, as a member of the Veterans Committee of the United States Senate, will see to it and ensure that we keep that commitment as long as I have a breath in my body. With that said, I'm going to open the testimony from our first panel, and I think Dr. Petzl will be first. Dr. Petzl, welcome.
Senator Isakson, thank you very much. I want to thank you for the opportunity to discuss with you the mental health care at the Atlanta VA Medical Center. I also want to talk about all of the veteran and veteran service organizations that are here today for their service to our nation. I'm accompanied by Mr. Charles Sepich, as you mentioned, the Network Director, Veterans Integrated Service Network 7, and Ms. Leslie Wiggins, the Director of the Atlanta VA Medical Center. VA provides many benefits and services to our nation's veterans. As the nation's largest integrated health care system, VA provides health care to more than 6 million veterans, and as of April 30th, 2013, VA has over 20,000 mental health care specialists providing care to the 1.3 million veterans requiring specialist mental health care. At the VA Central Office, we have an excellent mental health care group that provides vigorous support and oversight to our medical centers across the country. VA and the Atlanta VA Medical Center leadership take every veteran death, especially suicide, seriously. Even one veteran suicide is a national tragedy. Each time such a tragedy occurs, we re-examine our interactions with a veteran and our processes in order to understand how we can improve the care we provide. We expressed our regret for the incidents that have occurred at the VA Atlanta Medical Center and to those family members that have been affected. In April 2013, the Officer of the Inspector General, the IG, issued 2 reports concerning inpatient mental health care and contract outpatient mental health care at the Atlanta VA Medical Center. VA concurs with all of the IG findings and recommendations and remains dedicated to providing the highest quality of care to our veterans. Leadership in VA, VHA, Vision 7, and at the Atlanta VA Medical Center is taking aggressive action to address all deficiencies and ensure the safety of our veteran patients. These aggressive actions include holding our employees accountable. In addition, VA is working to implement President Obama's executive order to improve access to mental health services for veterans. Since May 2012, the Atlanta VA Medical Center has hired a total of 66 additional mental health employees, including 50 clinical providers, 6 administrative personnel, and 10 peer specialists. The Atlanta VAMC has strengthened policies and developed a system of improved processes to ensure patient safety on the inpatient ward. They've improved the root cause analysis process to ensure that all information is reviewed and that all follow-up actions are completed in a timely fashion. The Atlanta VA Medical Center has strengthened the mental health program oversight through heightened monitoring and notification of patient incident reporting, as well as the inpatient rounding process and the documentation of veteran observations. At the national level, VA is revising its inpatient mental health services to include greater standardization of the guidance for hazardous items, visitation, urine drug screening, and escort services. We expect to have this revised policy in place nationally by September 30th of 2013. The Atlanta VAMC is closely monitoring mental health care and management of the mental health contracts. To enhance the facility's ability to track and monitor patients receiving contract care, the Atlanta VA Medical Center has reduced the number of contracts with mental health organizations from 26 to 5. Additionally, we have placed case managers at each location to further monitor the contract services. The facility has also completed a comprehensive review of over 5,000 patients that were in the past referred for care. VA and the Atlanta VA Medical Center have implemented new processes to reduce wait times along with aggressive monitoring. 89% of the Atlanta VA Medical Center veterans receive a non-urgent mental health care appointment within 14 days with an average of only 7 days. And I would say that this is one of the best access waiting times reports in our system. To further enhance VA's partnership with community providers, all VAMC facilities will host a community mental health summit this summer. The Atlanta VA Medical Center will host its mental health summit on August 16th, 2013. In addition, VA has established national pilot projects with 24 community-based mental health and substance abuse providers. The Atlanta VAMC is operating 6 such pilots to enhance existing agreements or enter into new agreements with community providers. Enhanced agreements include additional coordination of care and the placement of VA staff in community locations to serve as case managers. It is expected that an increased number of veterans will complete a full course of care with community providers. And I might add that Atlanta is the largest user of community providers in our system. They are really a very good example of VA cooperating with the mental health community. Lastly, the facility has a long-term plan and new initiatives in place to expand mental health services and enhance access in the future. The Atlanta VAMC is offering expanded outpatient mental health services at the new Fort McPherson Healthcare Facility and expects to open the Oakwood community-based outpatient clinic in September of 2013. Sir, we at VA are confident that these initiatives are on the right track and have already improved the safety and quality of care offered to veterans here in Atlanta. The leadership and over 3,600 dedicated staff at the Atlanta VA Medical Center continue to work with our local VASO representatives to emphasize their commitment to providing the best care and access to mental health services in this country. We appreciate your support. My colleagues and I are prepared to respond to your questions.
Thank you. Dr. Shepard?
Senator Isakson, thank you for the opportunity to testify today on two recent IG reports on issues with contracted mental health care and inpatient mental health care at the Atlanta VAMC. I'm accompanied by Murray Lee, Director of the Office of Healthcare Inspections, Healthcare Financial Analysis Division. Reaction to these two reports echoes the absolute frustration and disappointment our team felt during the course of these two inspections. In the Inspector General's office, we seek to ascertain and analyze the facts, shed light on truth, good or bad, and make recommendations to VA leaders for improvement. Like Congress, the IG has oversight rather than operational responsibility, and we rely on those in positions of operational authority at VA to carry out promised improvements in our prior reporting. In a 2011 inspection, we substantiated that several mental health clinics had significantly high numbers of patients on their wait lists over a period of months in fiscal year 2010. And we substantiated that facility managers were aware of the wait lists, but were slow in taking actions to address the condition. Medical center leadership agreed to fix the problem. During the course of the two recent IG inspections, our team was extremely troubled to find ongoing problems with mental health services. Over the past few years, the medical center increased utilization of an existing vision contract for mental health care at the local community service boards. We found administration of the contract for mental health care was mismanaged. In addition, leadership did not put in place adequate mechanisms or staff to track, monitor, coordinate, and oversee patients referred for contracted mental health care. Although the facility estimated 5,000 patients were referred for contracted mental health care, in fact, they didn't even know who or how many were referred or if they were seen. When we reviewed a sample of patients referred by the facility, we found that at least 21% were never seen at the CSB. In the interim, patients did not receive ongoing mental health care at the medical center, and sadly, some patients fell through the cracks. One veteran died of an apparent drug overdose, a second committed suicide, a third veteran was incarcerated, and others didn't receive care. Equally troubling, on the inpatient unit, there was no effective implementation of policies or practices to ensure safety regarding drug screens, visitation, patient observation, and escort of patients off the unit. In addition, we found inaccurate documentation of patient whereabouts for a patient under observation who died while on the inpatient mental health unit as a result of a drug overdose. The findings in these reports are disturbing. We made several recommendations delineated in the two reports, and we hope changes implemented by the new leadership will improve access to outpatient mental health care and administration of inpatient mental health care for patients served by the Atlanta VA. The OIG will vigorously follow up with the VA in the coming months to verify the VA's promises to Georgia's veterans to verify that they are kept. Thank you again for the opportunity. We would be happy to answer any questions you may have.
Thank you, Dr. Shepard. Dr. Shepard, I want to ask you the first question. What was the root cause, to coin a phrase, that caused you to do these two reports?
Okay. For both reports, we have in the IG a hotline system where people can call in either anonymously or non-anonymously. That can be staff, that can be families of veterans can call in and report concerns. And both of these reports arose from hotline complaints, one from a confidential complainant and one from an anonymous complainant.
So you responded by doing these two investigations because of reports to your hotline by individuals that were anonymous?
One was anonymous, one was confidential, I believe. In addition, in the wake of the 2011 report, we had like a high sensitivity to the goings-on in the Atlanta VA also.
Did the Atlanta VA Medical Center in any way invite you to come do an analysis after the suicides took place?
No.
Okay. And were they cooperative when you came to do the investigation?
Yes.
Have they followed up on the record? There were 8 specific recommendations. I think 3 of them are still open. Is that correct?
Yes, that's correct. 3 are still open. We look forward to their actions to provide sufficient evidence for us to close those recommendations. And in addition, we are planning to return to the facility this fall to follow up.
For the benefit of those in the hearing today, as those listening, the Inspector General's office provides a tremendous service to the American people, and I hope you just understand what you just heard. These investigations were prompted by reports to the IG's hotline, and they responded and found these deficiencies. Am I correct?
That's correct, and I also want to take a quick moment to extend our gratitude to those who called the hotline, to the whistleblowers who pointed out and brought those problems to our attention, and the service they've done for Georgia's veterans.
Sometimes people feel dealing with the government is hopeless, and it's important to know we have opportunities for them to report grievances, have them investigated, and end up having responses like we're experiencing today. Thank you for what you've done.
You're welcome, sir.
Dr. Petzel, you did an interview in Washington a month or so ago, and I'm sure you haven't forgotten it, where you were asked by an Atlanta media reporter the question, have those responsible for the failings of the Atlanta VA in mental health been held accountable? And your answer was, what do you mean by accountable, if I remember correctly? In your opening statement, I'm going to read your statement, you said the following. These actions include holding employees as well as senior management accountable. So obviously in preparing for your testimony today, you know what that word accountable means. In the context of the findings of this IG's report and the actions taken by the VA, how did you hold those responsible for what's been recognized as negligence and mismanagement accountable for their actions?
Thank you, Senator Isakson. We've done several things. First of all, a number of people have been had both corrective and administrative action taken. 2 is that 2 people involved in this process have resigned retired from the VA, and then there are a number of actions which are still in process. I've shared the specifics of what has happened with the committee, and I understand the committee has shared those specifics with you. I am not able to speak publicly about the specific actions that have been taken, but hopefully the committee has that information in hand and you're able to see it.
I was able to review it last night, and I thank you for bringing it and providing it to the committee, and I thank Chairman Sanders for his cooperation in soliciting that response from you and from the department. And as I remember, and I'm going on memory because I turned those papers back in because they are private, and I realize that there were 3 who reprimanded for either negligence or failure to follow instructions. Is that correct?
There were 3 corrective, administrative, however you want to call them, actions that were taken.
And there are a couple, and those were agreed to by those who were reprimanded, but there are also a couple still open in administrative process. Is that correct?
There are a number of actions that are still in process. That's correct.
And is the VA committed to pursuing those accountability hearings and those processes?
Absolutely, sir. Yes.
Mr. Sepich, have you learned anything from the experience at Atlanta VA that might help you in South Carolina and Alabama?
Thank you, Senator Isakson, for that question. Undoubtedly, I have learned quite a bit, sir. I would tell you some of what I have learned is the importance of communication. We need to be able to communicate. We need to be able to communicate with our veterans and their family. We need to be able to communicate with our VSOs. More importantly, as you had recognized and as the IG recognized, I see it as very positive. Our staff wants to do the right thing and wants to make sure we're providing the best care. So that communication is predominantly one of the lessons I have learned, and every day we're going to work to improve and enhance that. But Senator, I would tell you there's some other things I've learned as well. Alignment, and it's the alignment of our staff with the outcomes for our patients. We need to make sure that we have personalized care for every veteran that we treat, and as you know, sir, every veteran may have a different need, so we are looking very hard at that. And the third thing is processes and systems. With the 3,600 people at Atlanta, most of them doing a good job every single day, there are processes that continue to need to be looked at and evaluated. Sometimes those processes, we need to improve on those so those outcomes will be better. Those are the primary three things that I have taken away.
Well, for you and for Dr. Petzel and for Director Wiggins, there's an important message in my response to what you said, and I appreciate your remarks. It is important for us to have our people who provide services to our veterans trained to deliver the service they're to deliver. But also it's important that they be counseled and we have a culture of cooperation and empathy and solicitous attitudes on behalf of our service reps. I think it's inexcusable, and I think one of the testimonies was 21% never received service of mental health people who were referred. Is that correct?
Correct.
That's inexcusable. I mean, that's absolutely inexcusable. Someone who has a mental health problem and may be at risk for their own life, to think 1 in 5 don't get any service at all. Secondly, and I don't want to misquote Sergeant Brown, who will testify in the second panel, served our country bravely. He will testify that he hears from many of the wounded warriors that the VA counselors that they meet with to discuss their mental health problems, which in themselves are sensitive, sometimes seem just not to even care. I know from personal experience of friends that I have had that mental health challenges are extremely sensitive and often become insular to the individual and not shared. And if someone is cold or uncaring or not solicitous, you can never solve their problem because they don't open up, they close up. And I'd like to hear from Director Wiggins, and I know you have some of your specialists in mental health here. What are you doing to see to it that the culture in the mental health department at the Atlanta VA is such that a veteran who goes there can actually get help because they feel like they're wanted, number one, and secondly, we're solicited enough to get the information from them to recommend a treatment pattern and a regimen that's appropriate?
Thank you, Senator Isakson. I can tell you one of the primary things I do each and every day I enter that building is remind the staff and support systems that I am working with daily that we are here only because a veteran risked his life for us. And I'm constantly identifying opportunities to keep them focused on that very important mission, whether it's making a decision about how to care for a veteran or how to build a new process that leads to better outcomes for veterans. I set the expectation and I model that expectation each and every day I'm in that organization. Thank you.
I talked to a veteran not long ago who's received mental health services from the Atlanta VA, who had a friend who also received services from the Atlanta VA, and he told me that upon first visit, that friend of his was medicated for his problem. Did not have another visit or contact with the Veterans Administration for a year and stayed on the medication. The principal comorbidity for deaths, suicide or overdose are drug abuse. The drugs that you use in mental health are themselves have side effects and need to be monitored closely. How can a veteran go to the Atlanta VA, have one appointment, be prescribed medications and never visit or contacted again for a year?
Thank you, sir. What I'd like to tell you is that some of the systems and processes Dr. Petzel just mentioned that we put in place will prevent those kind of things from occurring. First of all, every veteran that we see, when they first come to the facility, receive a comprehensive assessment. And so we find out what's going on. And like you said earlier, they receive sometimes medication immediately for that initial presenting problem. Now they are immediately attached with a clinical social worker who guides that veteran, stays attached to that veteran until they get those follow-up appointments, all of which we expect to happen in 14 days or less. Most of them happen right now around 7 days. That veteran, before he leaves our organization, receives the name, phone number, contact information of that liaison, and that liaison, each and every one of which I've met with, understand their responsibility in assuming the responsibility in making that next step appointment for that veteran. And they have all been successful in doing that since my arrival on station there, sir.
And the record should reflect that those policies did not exist prior to your arrival or prior to the report of the 3 instances in the VA. Is that correct?
Yes. During the time that the IG visited our facility, we did not have clinical social workers embedded in those organizations. We have 5 outpatient organizations and 1 inpatient organization you'll hear from on your second panel, Peachford. At each of those organizations, we have at least 1 licensed social worker in those organizations whose responsibility is to work with that veteran and that organization to make sure that veteran gets the care that they deserve, that care then meets the standard that the VA has set, so that there's no difference, there's no opportunity for them to fall through the cracks.
What's the caseload of those social workers?
Right now, it varies, but our goal is to keep that at a very working level. Right now, I think when I met with them maybe a week ago, they average about 1 per every 150 veterans.
It's 1 caseworker per 150
Right. But
veterans, or per
yes.
150 veterans in need of mental health service?
No, for veterans in the contract program. Now, there's a difference, sir, between the licensed social workers in these roles to prevent veterans from falling through cracks. They are not the healthcare specialist providing specialized treatment and care. They are the special liaison to make sure they monitor veterans as time goes on and make sure they go from one very specialized organization, the VA, in their mental health assessment, to another specialized provider in the community. So their ratio is different than you would have if you were providing the primary care that veteran needs. They are smart enough to know when that veteran's needs changes, when we need to expedite movement from one system to the other, and those kinds of things. So that's what they do. After they connect the veteran to the community organization, they then provide monitoring. Is that veteran coming to his appointments, his or her appointments? Are there things about that veteran changing? Are they not engaged? Are they not communicating with us? Do they need a return visit? Because if their condition changes, if something becomes urgent, they not only have communication opportunities with us, our licensed social workers reach out to them. They don't wait till things get to a point where they are lost in the system.
And in that particular example of communication between the veteran and the social worker,
right.
Is it not true that had that been in existence prior to your getting there, one of the 3 tragic incidents that happened at the Atlanta VA probably would not have happened?
Well, sir, I can tell you that their existence in those organizations has certainly sealed up a lot of the cracks that may have been in place before, because they take very proactive steps to reach out to these veterans on a daily basis.
How much do you share with other VA medical facilities your practices and what you're doing?
Every bit of it, sir. Ever since I have arrived, we have had the opportunity to communicate with not only central office, with other colleagues in this business. We have regular forums, not only in this division, but nationwide, where we get to talk as colleagues about best practices.
One thing I want to just point, I'll be right to you, Dr. Pestle. One thing I'd like to point out, and I know the staff behind me knows this, we've been on this issue for some time. About 2 hours and a half from here is Augusta, Georgia. You have the Charlie Norwood Uptown VA in Augusta, Georgia, where
Yes,
General Schoonmaker, who before he went to Walter Reed, instituted seamless transition from DOD severance to veterans health care, which is recognized nationally as one of the key programs to keep veterans from falling between the cracks.
That's right.
That's been in existence for 3 or 4 years, and I'm not being critical of you, but I'm just saying, I don't think the VA hospitals talk to each other. I don't think there's a conduit for communication. I hope these summits that you're getting ready to conduct will do that. But a lot of the things you've talked about, I know are in place at Augusta, and were in place before the instances happened in Atlanta. So I appreciate what you're doing, but it also indicates how much better communication we need within the VA facilities to make this seamless transition the same for our facilities as they are for our soldiers. Dr. Petzel?
Well, I was just going to comment, Senator Isakson. It's really my responsibility to see that these best practices are spread and made known throughout the system. And the example that Ms. Wiggins mentioned of the case management is something that we have taken out of the experience at Atlanta, and in terms of contract mental health care have implemented that or begun to implement that at other places where we have similar kinds of contracts.
Well, I appreciate you taking the responsibility for doing that, because in all the work I have done with the VA and with veterans and with VSOs and with families of loved ones who've been lost, the one thing that keeps coming around is that the organization is more insular than it is exposing itself to the outside, and therefore it talks to each other without talking to everybody it should talk to. And I think communication is a significant problem. And back to Dr. I'll get right to you in just one second. Dr. Wiggins, this ratio of 1 to 150 veterans in terms of your social workers, is that what you call them?
Yes.
Are they the ones that do the prescriptive treatments for the worker, or are they just the ones that see the worker gets to their appointments and follows their?
they're the ones, you're correct, sir. They are the ones who facilitate the movement of that veteran. That warm handoff that you just talked about, that's their primary role. They also oversee the care that's done there. They do chart reviews. They make sure that the folks that we are sending our veterans to understand the expectations, and they're there as a safety net for our veterans. The veterans can talk to you about, they know who these social workers are, that they're interfacing with them. Each of our community providers have given our liaison space right in their organizations. They not only facilitate oral communication, they also have access to our medical record systems for reporting back and forth key information that we want to have shared.
I know mental health and soft tissue issues are a whole lot different than sewing up a wound. And each one is different, which means each veteran's plan really should be individualized when it comes to mental health. One size doesn't fit all. Are your mental health experts with whom these social workers are working with in terms of the treatment plan for this veteran? A, are the plans individualized? And second, does the social worker get the communication to know what the plan is to work with the veteran to see to it they follow the recommendations? Absolutely, excuse me, sir. The first step is that they get what's called a MHAT exam, a mental health assessment treatment. It's an organization that totally exists to really give that veteran a very complex, very thorough overview about his or her needs. And from that assessment, they make a determination about which organization would be best to meet that veteran's needs. They also take into account where that veteran wants to receive their care. That's why it's important for us to have these community relationships throughout the state, so that the veteran can be close to friends or family, and it's their choice, basically. So after that MHAT exam, that very comprehensive exam, the social worker who's going to be responsible for that veteran in that next step is oriented to the needs of that veteran, how frequently they need to meet, the other care initiatives that are identified in the individualized treatment plan, so that when that veteran falls off of that plan, they quickly notify the professionals that we need to maybe change something about this veteran's plan. That's the huge difference it makes by having them right on site where they can easily access our veterans. Mr. Sepich?
Senator, may I go back to that question and that example you used of Charlie Norwood?
Sure.
I couldn't agree with you more about when you talked about the communications and that we need to work and be smart about that. I wanted to let you know and let the committee know, one of the things we've done is established a mental health council. What that council does, and it is vision-wide, and as you explained, it encompasses both Georgia as well as Alabama as well as South Carolina. But it does look at access. It does look at recruiting, and it also goes into some of the things Ms. Wiggins talked about. Complete agreement with the seamless transition. I will tell you, sir, that I have some experience with that, having been in charge of a polytrauma unit. I think there's many lessons we can learn from there, and that's one of the things that I want to take as my responsibility is to further communicate, not only in Vision 7, but as I support Dr. Petzel and our entire organization.
I appreciate your attention. I appreciate your recognizing the importance of sharing. As an elected member of the Senate, I don't want to encourage trips to Las Vegas and line dancing on behalf of the VA because that's gotten a lot of attention at the IRS. But I would say communication of best practices and a system to do that can be of immeasurable help because I ran a company. A lot of times you have workers who don't want to ask to be helped to do something because they think they're supposed to know when in fact they're new and aren't. So I think the better your communication, the better that culture is, the more problems you avoid.
Yeah. Yes, sir, Senator. And I think, again, the example with our staff wanting to do the right things is a tremendous asset that we are going to maximize.
Dr. Wiggins, you're not a doctor, but you should be. Director Wiggins, if one of your specialists prescribes a medication therapy, a pharmaceutical therapy to a veteran being treated for mental health issues, what opportunity does the veteran have to accept or reject that method of treatment?
Every bit of the opportunity. The decision is the veterans to cooperate with the care that's prescribed or recommended, actually. They sit down with the veteran. Part of the comprehensive assessment is to identify what that veteran would like to see happen, what that veteran's goal is for wellness. They really push at this Atlanta VA a program called Recovery Model, helping that veteran think about recovery versus being dependent on the mental health system. And that requires the veteran to be engaged, to speak up very clearly about what their end goal is. And then that clinical staff has to put that plan together to help that veteran meet that goal so that he or she can achieve their recovery. So if a veteran says, my goal is to be a senator one day, and something about that medication or that treatment plan is going to get in the way of that, then that team has to go back and redesign in a way that that veteran's goals are met along the way of getting well.
Do you think, this is a loaded question,
Okay, thanks for the warning.
but 21% of those veterans that visited the VA in Atlanta never got service. Remember that comment?
Yes, I remember that comment.
Given what's been put in place at the Atlanta VA, do you think that number would be the same a year from now?
Absolutely not. It's not the same today. I can tell you for sure that every veteran seeking care at our organization gets an appointment in no greater than 14 days, most of them within 7. Before they leave, that mental health assessment that I talked about that's real important in identifying what the veteran needs, they get their appointment. We call one of our community organizations, and they are working with us to make sure that veteran, before they leave there, they're assured that that next step is already outlined. There's someone in place to intercept me along my way, and if I have problems, I have a whole host of numbers and folks waiting for that call, and it's been working. I can tell you that.
Thank you. Dr. Petzel, in your remarks, printed remarks, I'm not sure whether you read all of them or not, so I won't say that you said them, but in your printed remarks that I received 2 days ago, and I appreciate your being almost right on time on getting that to me. That was very impressive. VA doesn't do that often, but you did a good job, and I thank you for that. You referred to 66 new employees at the Atlanta VA. Was that a byproduct of President Obama's executive order, or was that a problem in trying to beef up the social workers and the people in the mental health department?
It was really a two-pronged motivation for that. 66 new employees, 50 of them are clinical, 10 of them are new peer counselors, a new profession that we're instituting, and 6 of them were administrative people. And the hiring really began back as early as April of 2012, continued, and was accelerated after the IG report, and we discovered that there was a larger need than initially had been anticipated, and the Secretary made available the resources for Atlanta to hire even more people than we had originally planned. So it was two-pronged. It was a response to the IG's report, and it was a part of the hiring 1,600 new clinical professionals.
When the VA has a tragedy in one of their facilities, you have a policy called root cause, where immediately that organization and that hospital or that CBOC is supposed to investigate the incident, what it was and what happened, and see what the contributing factors were. Is that correct?
That's correct.
Was that done in the case of these 3 instances of 1 overdose and 2 suicides?
It was not done well. One of the major criticisms in the IG report was that there was poor follow-up and really poor institution, in fact, of the review policy. So it just was not done well. We openly admit that.
Well, I'm glad that you do, and the most embarrassing thing to the United States, is my estimation, of all the things that have come out in this, was that it took 2, one anonymous, one known whistleblower, to notify the IG that something was wrong in the Atlanta VA, when if you did a good root cause analysis, you would have known something was wrong, and you should have been calling your own IG to come in and investigate it. Am I right?
Correct.
Okay. And I hope I hope the VISNs and the other VA people will recognize, I appreciate what the IGs do. Their job would be a whole hell of a lot easier if the internal operations were such they got them information timely, and we looked not to clean up a mess, but to find out what went wrong and make sure it never happens again.
And we appreciate what they do, both with their hotline calls, elucidating problems that we're not aware of, and with their comprehensive review process that occurs every 3 years with their facility. They're very helpful to us, very helpful.
And I want the audience to know the IG's job is not to solve the problem, it's to identify the problem and the contributing and mitigating factors, but they do a tremendous job of continuing follow-up, and I'm looking forward to getting a follow-up report from the IG when y'all close those last 3 open issues of your 8 recommendations. I think that's important for us to know, not just for Atlanta, but for everybody else. Mr. Lee, I've left you alone. That's sometimes good, it's sometimes bad. You may get the last question. You're in charge of finances, is that right, at the IG, or your expertise is finances?
That's my expertise, but I do work for the Office of Healthcare Inspections, and so we look at the business side of the medical care. So in the case of this hotline, it was originally about contract mismanagement, and it quickly grew into seeing how the clinicians were overwhelmed with the number of patients. So we had extra inspectors come in, and we started to expand what we looked at.
Well, since you're a financial guy, I want to pose a question you may not know the answer to, but I bet you Dr. Petzl will, and I think this information is important. You know, the whole United States government bears responsibility to our veterans, whether it's GI Bill and education, whether it's me as a United States Senator to our military academies or to our bases or to our commissaries or whatever the issue might be. So we're not just inquisitors in Congress or the ones that give people a hard time. We're supposed to be the ones making your job easier. And I want to make sure the public knows, and correct me if I'm wrong, and Dr. Petzl, you will know for sure. But in this time of austere times where we are doing significant cutting in the budget, sequestration and the like, particularly at DOD, and I know General Butterworth knows exactly what I'm talking about. Is it not true that there's been no reduction in veterans' health care services, and in fact they are forward funded to avoid a government shutdown, stop cutting off service?
That's correct, sir.
Okay. I just want everybody to know that as bad as we are sometimes in Congress about not thinking about unintended consequences, when we've gotten in these budget battles and these cuts, we have ensured that veterans' health care, A, is not cut, and B, is forward funded. In fact, it's the only unit of the budget that in history has ever been funded for 2 years in advance rather than just one. And we did that 3 years ago after the first government shutdown crisis.
That's correct.
For our VSOs that are in the audience and our military personnel, that is evidence of the commitment your country has to you. And now we're going to be committed to seeing to it the quality of service continues to match the quality of funding. Ms. Wiggins,
Yes.
I missed a question. We were talking about medication, which is a very important question.
Okay.
Who provides, once one of your counselors makes an analysis and prescribes a medication and discusses it with the veteran and the veteran says, I'll take it,
Right.
who provides that prescription, a pharmacist or the VA?
The VA pharmacy.
What attention is paid to drug interaction?
A great deal of attention is paid. They have mandatory checks of what the veterans are on. They run tests, and I don't want to misspeak, but they do have required reviews of the patient's medication. We have a pharmacy and therapeutic committee that looks at untoward events and some other things. And for the record, if you need more information, I can have those experts talk to you about how they do that. But that's a regular part of the process. And maybe, Dr. Petzl, you can speak more to it.
I would want to describe two things,
Yeah.
Senator. One is that because of the advanced computerized medical record system we have a very sophisticated drug-drug interaction program in that computer, which does an excellent job of warning people about the potential conflicts of drugs. But I think more importantly is that we have instituted a program for people that are receiving psychotropic drugs, the things that you would see prescribed for depression, PTSD, etc., where we now have a printout, which we can distribute to each one of the medical centers that describes what we call outliers in terms of doses and numbers of drugs that they're receiving, and also reflects the people that are prescribing. In other words, looking at outliers in terms of prescribing. And then we send in an individual to do what we call academic detailing, which you might call counseling, to discuss the prescribing habits with individual practitioners. Where we have done this, there's been a dramatic reduction in the number of drugs that someone is taking and a dramatic reduction in the doses of the drugs that people are taking. And we believe that this is the future in terms of controlling the prescribing of psychotropic drugs.
And the electronic system is a great big asset to the VA. There's been
huge
testimony
asset
to that from the outside.
Yes, a huge asset.
Fully integrated.
I want to go to another subject of contributing to the mental health of our veterans, and that's the wait times for adjudication of claims in the VA, which are awful. They've been improving a little bit because of the mandated overtime periods and things like that. I know there's a integrated computer system that's supposed to be in by 2015 that's supposed to be the solution, but I also know we got 1 million veterans on top of the veterans we serve today who are coming. The wait times are totally unacceptable for service. Now, you mentioned in your remarks, I quote, over the last few months, the facility has reduced appointment wait times 89.6% of Atlanta VAMC veterans receive a non-urgent mental health appointment within 14 days. Are you paying that type of attention to claims other than mental health?
That doesn't refer, sir, to claims. That refers to people that are coming to
Because
us
to service.
for health
But a
care,
claim
for
is a
service.
service, although
claim
it's
is a
more,
service.
I understand it's more complicated than that.
Yeah, the Atlanta VAMC actually has done a very good job. There are two aspects to this. One is the work that the Veterans Benefits Administration does, and then our role in this is providing the examination for a claim. So they'll file a claim with VBA. It will then result in VBA asking us to do an examination, and the Atlanta VA Medical Center does an excellent job. We get across the nation, we get these medical exams done in less than 30 days across the country, and that applies here as well. There are other parts of adjudicating and getting that claim eventually done that VBA is, I think, doing a very good job of trying to address. One, they're computerizing their record system. You know, it's been a paper-bound system for as long as I've been in the VA, and now it's becoming computerized. And with the overtime, et cetera, they've actually dropped that backlog by 100,000 last month and 100,000 the month before. We'll make that goal of getting the backlog and getting the claims done within 120 days. We'll make that goal by 2015.
Well, we're moving in the right direction.
We are.
And I think it's, of what I've heard today from you, I want to acknowledge to the audience the fact that in your first response to me, you took responsibility, which I really appreciate. You know, the head of the program is the head of the program, and what happens in the program is a reflection on how good a job you're doing.
Correct.
And part of that is taking responsibility for the job that you have, and I appreciate that. Ms. Wiggins, I appreciate the fact that within 2 weeks of coming, or a month of coming to Atlanta, you've made an appointment to come see me and give me more information than I needed to know at the time about what you were doing. And if you'll keep up that momentum, then we can address this. And
Okay.
the Sasepich Division 7 is a very important region for me, Senator Graham, Senator Scott, Senator Shelby, Senator Sessions, Senator Chambliss. Those are our three states, and we want to have the best service to our veterans we can possibly have. I have been impressed with your answers and your attention. I hope you'll continue to focus on that. And if you'll work on that collaboration like we talked about, it was done at Charlie Norwood VA, I think we can overcome some problems that we have. I've asked you all to stay for the second panel.
We will.
Yes.
And I have for a specific reason. I'm told y'all don't listen very good to the outside, and I'm told you're not good at asking for help from the outside. You're going to hear from a lot of people who want to tell you what their problems are and want to offer you help that deal with the same terrible traumas that you have to deal with every day in the private sector. It's very important. I want to thank the IG for coming today. I want to acknowledge to the audience that I was given one voluntarily submitted testimony from an organization known the Institute for Veterans Health. It will be submitted for the record. If anybody else has information they want to submit to the committee, all the brains of this organization is not me. It's behind me. And so if you have something you'd like to submit today, if you'll bring it forward at the end of the second panel, we'll be happy to include it for the record. And while I'm pointing over I guess they're still there. They're still there. Make sure they're there. We are so blessed in the Congress of the United States to have the type of staff that allow us to serve 10.5 million people and over 750,000 veterans in our state. And I have a tremendous staff. Senator Burr's staff from North Carolina is the ranking member is here. Senator Sanders from Vermont, who's been great in facilitating this hearing today, has provided staff, and I appreciate what they're doing. They spent yesterday in Atlanta, and they'll spend today with the VA in Atlanta, seeing on the ground that what we're hearing is in fact what's happening, because we're a trust but verify committee.
Absolutely.
Don't just make us a promise that you can't keep, and don't tell us you've done something you ain't done, because we're going to make sure that our veterans get the very best service possible. Does anybody have a closing comment they want to make?
If I could, Senator, I would just like to, first of all, thank you for the opportunity to get the issues out in front of the public as it relates to Atlanta. But I do want to add my recognition to what Chuck Sepich and Leslie Wiggins have done in terms of moving forward. I really do believe these are leadership issues. These are fundamentally leadership issues. And I think we have the right people in place in terms of leadership to move this medical center and move this network forward. And I just want to recognize the good work I think they've already done in a short period of time.
I appreciate you doing it, and I'm going to let you leave with a homework assignment. when you shared with me your accountability letters and reprimands of the personnel at the VA in Atlanta, there are 2 that are still open to administrative hearing, if I'm not mistaken.
Correct.
I hope you'll provide me with the final adjudication of those cases when they occur and whenever they occur, because accountability for the actions those people took is absolutely something we owe, not just to the veteran's memory, but to the loved ones and the family members of that veteran.
You have my promise, we will.
I thank you. We'll take 2 minutes to switch panels, and then we'll go right into our second panel, so everybody just stay put.